Communities around the world have slowed the spread of the coronavirus by locking down society. But there is fear the virus will begin to spread again once those restrictions are lifted. Renu Dillon, a doctor, worked in Guinea in West Africa during the Ebola crisis. He helped find people who had encountered a sick person, a practice known as contact tracing.
But certainly with Ebola, as soon as somebody had symptoms, we would try to recreate where they've been, who they've been around. Based upon that, we would then be able to make a list of people who were contacts. And we would follow those contacts for Ebola for 21 days.
COVID-19 presents challenges to tracing contacts. Some never have symptoms. Others can spread the disease for a day or two before showing symptoms. But what if you could digitally trace people who have been exposed? Apple, Google, and others are looking into using smartphones to inform those who have crossed paths with an infected person.
Something like digital contact tracing, I think, could make a huge impact in terms of automating the process of identifying who is around somebody for those periods of time.
Some countries have been using cell phone apps to trace people who might be sick. This proposal relies on Bluetooth, a radio signal built into phones to connect to other devices, like headphones. It is constantly emitting and listening to signals, a long string of numbers. Maybe once a day, the phone will do an exposure check. Contact a server to see if one of the beacons you received came from someone who tested positive for the coronavirus. But will it work and be accurate? Mark Zisman is with the Massachusetts Institute of Technology's Lincoln Laboratory, which has worked on missile defense and laser communication to the moon. He and his colleagues are testing how to measure the energy emitted from these Bluetooth beacons so that digital contact tracing works.
When these Bluetooth signals go between the phones, you measure how much energy is received. And you use that in part. It's not the only thing you use, but you use that in part to try to estimate how far apart you are.
MIT is working to test how best to measure signals in a variety of situations. Bluetooth signals pass through walls, for example.
Was it free space between us, or were there things, whatever? Was there a mask? Was there a wall? Was there a piece of glass? Were we facing different directions altogether? I mean, those things all matter. And so we got to measure that too. And that's really hard.
In the model Apple, Google, and others are proposing, no name is shared, no location is shared. The beacon data lives on the person's phone, making it less of a target to hackers than if government health authorities stored the data. Of course, the phone in your pocket isn't going to tell you whether you're carrying the virus, but digital contact tracing might play an important role as society opens. Michelle Quinn, VOA News, Oakland, California.